Hello everyone. Today, we're exploring the medication Dutasteride, widely recognized under its brand name, Avodart. As always, this discussion is designed for educational purposes. If you have any health-related questions or concerns, please consult with a healthcare professional. Description: Dutasteride, marketed as Avodart, is a medication administered in the form of an oral capsule. It belongs to a class of drugs known as 5-alpha reductase inhibitors. Dutasteride works by reducing the size of an enlarged prostate gland by blocking the action of an enzyme in the body, 5-alpha reductase, that converts testosterone to dihydrotestosterone, DHT. Lowering DHT leads to shrinkage of the enlarged prostate gland, which helps to relieve symptoms of benign prostatic hyperplasia, BPH, such as difficulty in starting urination, weak stream, and the need to urinate frequently or urgently. It may also reduce the need for surgery related to BPH. In some cases, Dutasteride is used in combination with another medication, tamsulosin, as part of a dual therapy to enhance treatment effectiveness. Warnings: Dutasteride should not be used by women, children, or adolescents. It can be absorbed through the skin, and women, especially those who are pregnant or could become pregnant, should not handle Dutasteride capsules as it can cause birth defects. Individuals with a known hypersensitivity to Dutasteride or any component of the product should avoid it. Before taking this medicine. Before starting Dutasteride, it's crucial to discuss your medical history with your healthcare provider, particularly if you have liver disease, as Dutasteride can affect liver enzymes. It's also important to inform your doctor if you have a history of prostate cancer, as Dutasteride can affect the results of certain tests for prostate cancer. Regular checkups and prostate-specific antigen, PSA, tests will be necessary to monitor your condition and check for side effects. You should not donate blood while taking Dutasteride and for at least 6 months after your last dose, as the medication can be carried in the blood and could cause birth defects if a pregnant woman receives a transfusion with blood that contains Dutasteride. Side effects: while Dutasteride can be beneficial, it may cause side effects. Common ones include impotence, decreased libido, ejaculation disorders, and breast tenderness or enlargement. These side effects can persist even after stopping the medication. It's essential to communicate with your doctor if you experience any adverse effects, particularly symptoms like swelling or lumps in your breasts, pain, nipple discharge, or any other changes, as these could be signs of male breast cancer. Interactions: Dutasteride can interact with other medications, so it's important to tell your healthcare provider about all the medicines you take, including prescription and over-the-counter drugs, vitamins, and herbal supplements. Dosage: the typical dosage of Dutasteride, Avodart, for the treatment of BPH is 0.5 mg taken once daily, with or without food. Consistency in taking the medication at the same time each day is recommended for the best effect. It's important to follow your healthcare provider's instructions closely and not adjust your dose without consulting them. Avoid: while taking Dutasteride, patients should avoid activities or situations that could lead to injury or bleeding, as the medication can increase the risk of significant bleeding. Patients should also be aware that Dutasteride may cause dizziness or drowsiness, so caution should be exercised when driving or operating heavy machinery. FAQ: a common question about Dutasteride involves its impact on prostate cancer screening. Dutasteride can lower the PSA levels in your blood, which could affect the detection of prostate cancer. It's important to inform your healthcare provider that you are taking Dutasteride before undergoing PSA tests. Closing: that concludes our overview of Dutasteride, also known as Avodart. This session is intended to inform and should not be used as a substitute for professional medical advice. For any questions or concerns regarding this medication, please consult with a healthcare provider. Thank you for joining us.